Welcome and thanks for pressing play. This episode of WarDocs was made possible by a partnership with the Defense Strategies Institute's OP Med TV and was recorded at the 2024 Operational Medicine Symposium in San Antonio. These interviews focus on optimizing military medicine through the modernization and implementation of policies, education, training, research, and development. We also explore emerging technologies to enhance the health, strength, and survivability of warfighters. Welcome to this special edition of WarDocs Podcast in conjunction with OP Med TV. I'm your host, Dr. Doug Soderdahl, retired Army urologist, and I'm joined today by Rear Admiral Guido Valdes. And he is the commander of the Naval Medical Forces Pacific. Thanks for being with us today.
Thanks, Doug.
So tell us a little bit about this current job that you have. What is going on with the medical forces in the Pacific, and how much medical forces do we have there?
Sure. So my job right now is as commander of what we call Naval Medical Forces Pacific, which encompasses the military treatment facilities in the state of California, Washington State, and the Pacific. That is what I call my regional job, my service side job, where I'm the commander. And of course, on the healthcare delivery side, I'm dual hat as the director for DHA for those facilities as well. And in the Pacific right now, things are very dynamic. As you can probably tell, there's a sense of where we're going in terms of the geopolitical situation in the Far East. And so there's a lot of interest in what is the medical footprint there, not only in support of the war effort, but in support of our beneficiaries there, which is a very large footprint between Japan, Korea, Okinawa, Guam, and Hawaii. So it's a very challenging time right now as a result of, I'm sure other speakers that you have interviewed have talked about our current manning challenges, recruiting challenges, retention challenges within the medical community, not only medical corps, but also corpsmen, nurses, and other support personnel. So if you're asking me about, a couple of words on where we are, it's a very dynamic and a very challenging time right now, I believe, for the medical force in the Pacific. But not for lack of effort. We're trying to face those challenges and see how we can get to where our operational commanders want us to be.
So for that beneficiary care mission, I suspect it's very difficult in very remote places for people who are beneficiaries, but they need specialty care.
Right.
How do you decide whether or not they can get that care locally on the economy, or if they have to go somewhere else to get treated in a higher level of care?
Yeah, traditionally, as you know from your time in service, we are very closely aligned to our partners, our partner nations, particularly in Japan and in Okinawa. We rely on those local networks for some of that advanced care. So we work very closely with the Japanese and also within the island of Guam to make sure that we are partnering for that care. But it does become challenging, and there are times that we need to send folks back either to higher level of care in, say, a place like Tripler in Honolulu, or even back to the continental United States. It does create some churn, as we say, because there is an expectation that the care will be commensurate to what folks are used to back in the States. And so that can become a little challenging. If you add to that the fact that we're having a little bit of a problem retaining certain specialties within the service, and being able to project that capability forward can sometimes be difficult. But we work it out. A lot of that goes into the overseas screening process that we do in the Navy, where if you're going to get posted in an overseas location, you have some medical screening so that we can assure that we can provide that care in that location. And also we partner with the other services, especially the Air Force, to be able to move patients around efficiently, within the AO.
So what would you say are some of the main operational medicine challenges in the Indo-Pacific region? You've got the tyranny of distance, you're providing care in often austere locations. What are some of the major concerns of preparing for that next whatever could happen in this dynamic place?
Yeah, I will tell you that my major concern is centers in logistics. Our medical providers answer the call, and being in the old days of the Sand War, in Iraq and Afghanistan, I saw that people would come forward, they would learn, they would perform. I have no doubt that our folks are going to perform. My main concern is, are we going to be able to support them properly, given this tyranny of distance, given all these issues that we have with moving stuff around the theater. That includes moving people, that includes moving medical supplies, and that includes moving blood. I think that those are the biggest challenges that we have, and the only way we're going to meet that challenge is on a joint basis. Neither the Army or the Navy or the Air Force have the one-stop shop solution for a lot of these problems. So I think that based on my experience going through a lot of exercises, large-scale exercises in the Pacific, that is the main challenge right now that we still have a ways to go is how do we address some of these logistics issues, given the fact that we have a lot of people spread around a large AO, with the fact that we're going to be in a challenging situation in terms of we're not going to be as free to move as we have done in previous conflicts. So how do we solve that is, I think, the biggest threat and risk that I see right now in the Indo-Pacific.
So one of the things at this symposium, there's a lot of interesting, novel technology that's being presented. Is there anything that you've heard today or recently that excites you that may help some of these challenges in the future to provide care in a contested environment using technology, whether it's information technology, AI, or actual gadgets that are autonomous or whatever?
Right. So one of my other jobs is that I do have responsibilities over all of the Navy medicine research and development laboratories across the world. So I have 8 of those. A lot of research going on there. One of the most exciting parts of the research, and again going back to my previous theme about logistics and medical supply, is blood products, alternative blood products. I think there's a lot of exciting research going on right now on some substitutes that will help us provide that asset in very austere situations. I think that's one of the biggest game changers that I see, because as we learned in Iraq and Afghanistan, early resuscitation with warm blood saved lives, and it worked. Are we going to be able to do that in the Pacific? I'm not sure. I mean, I'm sure we're going to get some, but the question is how can we get that? How can we get something to that independent medic in the Navy, the corpsman, or somebody in a very small island in the Pacific or in a very small ship in the middle of the ocean, that they can provide that initial resuscitation adequately? To me, that's one of the things I've heard here, some of that research as well. I've also seen a lot of great stuff on movement, patient movement, and some of the new, I'm going to say, gadgets or tools or whatever you're going to call it, that we're being used to scale, to make that more scalable, more agile, more light. Because our theme in distributed maritime operations is agile, rapid, light. Right. We use all those terms. But we need the equipment that will be able to do that effectively, and sometimes that equipment can fail in austere situations. So I've seen a lot of great stuff here in the exhibition hall on some of these different, like moves system to address some of those issues. So I think that, again, patient movement, medical logistics are going to be the big challenges, and I think there's a lot of great research and a lot of great ideas being floated about how we're going to address that.
One of the other things that is, as painful as COVID was, it kind of brought to our attention that preparing for pandemics, preparing for sea burn type things, is there any research going on,
Yes.
in these 8 global places that is really specifically looking at how do we deal with the next pandemic, or if it's a biological weapon? Yeah,
well, I will tell you that to go back to the war at sea, there's a lot of interest right now in high energy weapons. What are those effects? Particularly to folks who could be exposed to something that we've never seen before. So you talk about the unforeseen, like could we ever foresee the COVID pandemic, or right. The unforeseen thing is high energy weapons. Also, the industrial environment in which these injuries will happen. So think about a ship and all the different systems that are within the skin of a ship, electrical, gas, all sorts of things. And when those things get blown up, what does that create? So we're seeing a lot of research on human performance, in that context, exposure to different hazards that maybe in the battlefield you would not be exposed to, because it's, you're in battle, you're in an open field perhaps, but you don't have that exposure. Moving away from the Indo-Pacific, a lot of research going on cold exposure as well, because of course we still have to worry about that part of the world and the high north.
Right.
So on the Navy side, we're doing a lot of research on human performance in extreme cold. We've already been doing that. We have our mountain warfare school in Bridgeport, California, where a lot of the Marines go to learn how to do that. But we really haven't had a concerted effort to understand what it's like to operate in that environment from a ship, or in a submarine that has to surface on a day-to-day basis, and how does that affect human performance, and particularly how does that affect the delivery of medical care in that environment. So there's a lot going on in that regard that I think will hopefully answer some of those questions.
How about in the world of global health engagements? I know the Navy's very involved in working with partner countries and doing things. Are there any initiatives that are exciting to you that's going on?
Well, we in the Pacific, that's been kind of like business as usual from a long time ago. Whether you're talking about Cobra Warrior, Brimpac, Balikatan, all these exercises that we do with partner nations continue and are invaluable to what we do in the Pacific, because it's not only the warfighting piece per se, but also it's the interchangeability, the interoperability for the medical folks to work together. But I know that there is an impetus to increase that bandwidth, with particularly in some countries where we feel that's going to be, from a geographical point of view, that's going to be very important to be able to operate and to provide forces, in those locations. So I know that mostly flows out of our operational medical headquarters, with the Pacific Fleet and 7th Fleet there. We augment those efforts with our medical personnel from our medical treatment facilities on a continuing basis. And of course, we also send our medical platforms based out of the MTFs to these exercises to not only train in their basic skills and get certified, but also to build those partnerships.
One of the other hats that you wear is the director or chief of the medical corps for the Navy. And some of the concerns that have been around in a while for the medical corps has been with retention, recruitment, and making sure that the force mix is appropriate for what we're needed to do. So do we have the right mix of docs? What is the current state in the Navy of the concerns with recruitment, retention, and particularly that mix?
Well, to be frank, not good. We are, and I don't think it's just the Navy. I think all the services are facing similar recruitment challenges. So on the recruitment side, obviously there are more choices now for a potential candidate to medical school to seek, a scholarship outside of the military. There are a lot of
there's medical schools that are free now.
Exactly. So we've had some challenges in filling all of our health professional scholarship positions in the past couple of years. So to be completely transparent, we have actually this coming week, we are meeting with Navy Recruiting Command, and that is going to be a 3-day event from Bureau of Medicine and Surgery with Navy Recruiting Command to see how Navy Recruiting Command can improve our medical recruitment. Because at the end of the day, we outsource that recruitment to Recruiting Command.
Yep.
Bureau of Medicine does not have an organic, recruiting shop within our headquarters. So we're meeting with them not only to let them know, hey, we have problems and we need to recruit better, but how can we help you via obviously engagements at the flag level through what we call Navy Weeks or Fleet Weeks, which are basically community outreach events that happen year-round. Whether it's engagement in high school through STEM programs, at medical schools, because obviously we can still recruit out of medical school, first year or second year students to come in. So how do we develop a more concerted, deliberate effort into recruitment? Because I think in the past we've been a little bit more like, hey, it's free education, so why not?
That's all we have to say.
That's all we have to say, right? But right now the options are more varied, and I think students have a different ways of looking at their careers outside of the military, and find that. The other thing is providing an understanding of what a career in military medicine is. And I think there's also a lot of concern among students about their ability to get the education that they want in the specialty that they want, concerns about being deployed and being stationed, in faraway places, and in our case in the Navy, in overseas locations. I think there's a lot of concern about that, even at that early stage of their career, because we live in a different world right now. I mean, information is out there. I think when I came in, 34 years ago, and I got the shiny trifold from the recruiter, I had no idea what Navy medicine was. All I thought, hey, it's free education.
Yeah.
But I think our young people right now are more savvy than I was back in the day. They have more information at hand, and so they see things. They read social media, they look at blogs. So they're more savvy about some of the issues that we're having. So they reflect on that and say, oh, I'm not so sure I want to go into military medicine. I'm hearing a lot of things that are not going right. So part of that is the outreach to make them understand the goodness of a career in military medicine, which I believe is an outstanding place to be a physician. But try to speak to some of the issues that we're going through right now and put some context into that.
Now you're trained in emergency medicine,
Sir.
And where would you find a Navy emergency medicine physician in the battle space? Where would your specialty go?
Yeah, so right now we are still part of our legacy expeditionary medical facilities, which are our larger land-based Role 3 facilities. And then going forward, we are an integral part of what we call our Role 2 light maneuver, to use a more joint term, what we call the ERSS, the Expeditionary Resuscitative Surgical Suite, which is our essentially 7 to 8 person team that provides that Role 2 care in a more forward location. So emergency physicians are part of that. And then of course we're working through newer platforms as far as our newer hospital ships and our newer land-based expeditionary medical units, which will be more scalable and more adaptable. Our legacy EMF is, it's a large footprint,
right? And
although it's very capable, it is not necessarily as agile and adaptable as we would want it to be. So we're working. So our emergency physicians will be in the Role 2 arena for the most part, and probably some in the Role 3. And of course, we need them also at our overseas MTFs. Because they are there providing that 24/7 beneficiary care.
Right.
But those MTFs, when things happen, do become platforms, for us. They are Role 3 platforms ashore that are an integral part of the O plan. So our emergency physicians are there as well, working, day to day, doing, the bread and butter, standing duty, seeing patients, and then sometimes being deployed for emergency missions, to support a particular exercise or something like that. So we are. I wish we had more of us in the Navy, but we are mighty, and we support across the whole spectrum of military operations.
Now, in your career, you've deployed multiple times, and I always like to ask, the clinical professionals, are there any cases or experiences that stand out in deployment that are just memorable for you?
Yeah, for me, the most memorable was my first deployment to Iraq. At the time, I was, I think, about 10, 11 years into my military career. I was a very senior 05, a very junior 05, and I was just augmented to the Marine Corps. The usual way that Navy docs get, deployed at the time, and I wasn't expecting it, but I was told that I was going to be an OIC at a very small forward location because there was like nobody else. They just picked people. I mean, there was no real vetting process for that. So that experience of leading a team in a forward location cemented my intention to stay in the Navy for the rest of my career. It was an outstanding experience being relatively junior because, as a medical corps officer, by the time that you get done with training and with your utilization tour and you get your boards done and everything like that, you wake up and you're already a senior 04,
right.
Junior 05. So you really haven't had the experience to lead in that context until maybe that time in your career. So that was my first opportunity to do so. And I went out with a great team. It was not easy, but at the other side of it, I realized that this is what I wanted to do. I wanted to practice medicine, but do it in a setting that really challenged you and provided a variety of experiences that you wouldn't get, I think, in the civilian world. And I think that's one of my pitches. When I'm talking about retention, is that it is a unique place to practice, and you may not be practicing maybe some of the ways that your civilian counterparts that at the university setting or the community setting are, but that you will never ever be able to have an opportunity to lead people through a difficult situations and to understand what it takes to do that, and to me that was the hook. There were a lot of great cases clinically and everything like that, but to me the hook was the ability to bring a team of different levels of experience together and to see it hum, when that trauma casualty came in, and whether it was an 18-year-old corpsman, with maybe 2 years of experience, or a 50-year-old reserve surgeon who had a lot of experience, and to have all those people come together and work as a team, to me was the most satisfying thing I ever did, and I was able to do it several times in my career. And for that, I remain eternally grateful to the U.S. Navy, because it's been a great experience.
So one of the common things that I hear is that sometimes when docs deploy, nurses deploy, clinical professionals deploy, they aren't sure exactly what they're going to expect to see, and am I ready for this? Am I prepared? So when you went out as a junior 05, going on the way out there, what were you saying to yourself? Am I ready for this? Do I got this?
Yeah, I mean, if you're honest with yourself, you always have a little bit of doubt as to whether you're ready to do that. But I always believe that you fall back on your training, you fall back on your core values, and if everybody has the mission focus of what we're trying to accomplish here as a team, everything sort of falls into place. And I think I saw that in all the instances when I went out with a team. There was a variety, like I said, a variety of talent, experience, human experience, diversity, both ethnic and otherwise. And that's the beauty of the military, is that we all come together because we have one mission in mind, which is to take care of that casualty, take care of each other, and make it home, in one piece. I think that that's why we will succeed eventually, against all odds, against all the things that you're hearing maybe these days about where we are as a military healthcare system and all these issues that we have. I still remain very optimistic that because of the quality of training that we receive, both in our MTFs and outside of the MTFs, but not only that, but our culture, that will make us successful, whatever the challenge may be.
So you have to excuse me, I'm an Army guy, and so I saw this in your bio. I wanted to ask what a Fleet Marine Force warfare officer is. Or what does that qualification mean?
So that qualification is this pin that I'm wearing right here. The Marine Corps doesn't have a medical corps. Right. The Navy is the medical corps of the Marine Force, of the Marine Corps. When you join, when you're deployed, or you actually PCS to a Marine Corps unit, if you are not a Marine, you can go through a program where you undergo training, both physical and academic training, to understand the Marine Corps, to understand what the Marine Corps does, to understand the culture of the Marine Corps, and also to undergo some of the physical challenges that the Marine Corps puts their Marines through in terms of their physical training, etc. Also combat skills training, and it's a whole program where you go through it, and at the end of it, you sit for a board, you go through a physical training evolution, and you do some combat skills, and if you pass all of that, then you become qualified as a Fleet Marine Force officer. And it's something that we as medical, and this applies to all our corps, including our corpsmen, so Nurse Corps, Medical Service Corps, Dental Corps, and Medical Corps are eligible for that program as long as they're attached to the Marine Corps. And it's something that we take a lot of pride on, because it kind of like cements that inseparable relationship that we have with the Marine Corps. Right. That goes back to 1775, when we first got underway with Marines on board of our ships.
Yeah. So going back to you said you saw that trifold. Tell me your personal story of how did you initially get on that path to Navy medicine?
I had finished my bachelor's degree, and frankly, I was looking at how I was going to pay for medical school. So plain and simple, it was a financial decision to come in. At that time, I don't think my family was able to support me in a way, and I wouldn't say I had bad grades or bad MCAT scores, but I wasn't scholarship material, from that perspective. And I got that trifle. I called a recruiter, and we had a conversation. And after that, I was sold. I said, this is what I want to do. It's they're going to offer me everything I need, and I'm able to go to medical school, which was my goal at the time. As I journeyed through my first few years in the Navy, frankly, it's something that fit my personality, it fit my interests, it fit my curiosity. One of my first postings coming out of internship was overseas, so I was able to go to Europe after doing a year of internship, and being able then to get residency training in the field that I wanted. So just one thing built upon another, upon another, upon another. So I think that's how a military career is made of these chains that you can never predict where the hooks are going to occur, that sort of keep you going. And for me, the next job seemed to be interesting and different enough to keep me in. And of course, at the end of the day, it's about the people that you work with. And during residency, you have an opportunity to go out and work in the community quite a bit. And I always look forward to coming back to the MTF, because it was like being back home. And you can see that here in this conference. It's about the people and the relationships. And I think that's very difficult to replicate on the outside, as we say. So for me, it's been sort of like I never had an end goal per se. It was just kind of like little goals along the way. And you wake up and you have 20 years in and you're like, wow, maybe I'll stick it out for another 10. And here I am. So it worked out really well.
So, I mean, eventually the military career comes to an end. The Navy says, thank you for playing 34 years as much as you get. What do you think is the thing that you'll miss most when you retire from Navy medicine?
Oh, definitely as I said, the people. I think that the relationships that I have built over 32 years are invaluable, irreplaceable. The ability to walk into a place that you've never worked before, but being able to come together because we have a common culture, a common understanding of how we do business. That is not something that you can find everywhere. So I will miss that. And then I will also miss that sense of pride of wearing the uniform. I mean, you always wear the uniform, I think, with a sense of pride, and being able to put that uniform on in the morning and know that this is what I do. I don't know, we'll see when I get there, but I predict that is going to be a change, because it really does affect what you do on a day-to-day basis, is the fact that you're on duty 24/7 when you're wearing the uniform. You're never off duty. You're never completely, off the clock. And so, however challenging that sounds, I think that gives you structure and that gives you purpose. So we'll see how that works on the other side of this career. So
yeah, after retirement, I have to worry if I can still fit in my uniform.
Yeah.
That's the big worry for me.
Right.
So we talked a little bit about recruitment, and we've got some high school students, some college students that listen to the podcast, and they may be interested in a career in military medicine, whether it be corpsman, medic, nurse, PA, PT, the whole team.
Right.
What advice would you give them specifically?
Well, I would say that, number one, get informed. Understand the military medicine as much as you can. I think there's great resources now, much more than I had when I first came in. Talk to folks, talk to people, get the information you want to make sure that you're making the right decision. Number one, I think that's important, particularly in this day and age where I think there's more of a need for that, for folks to feel comfortable, truly comfortable taking that step. I think the other piece is coming in will put you in very interesting places and in very interesting historical contexts. Being part of something that will be remembered in history. Right now I look back to my career and all the things that I was able to do, the places I was able to go, the people I was able to meet. Really, I couldn't have done it without being in the military. So my pitch is, you're going to be a witness to history in one way, shape, or another. Not everybody gets to do that. And I'm thinking of the future, in the next 5 to 10 years, who knows what's going to happen. I mean, September 2001, we were thinking, yeah, maybe something is happening, there's some stuff going on, but we're not prepared for that. And so you're thrust into the history of the world, into history. And I think, and then the final thing is, if you're into sort of like the more heroic thing, you're going to be, I always use the analogy of the firefighter. when everybody's like filing out of the building, you're the one going in. And I think that's what we do. And if you want to be part of that, if that's within your DNA, that you want to be part of an effort where you're going to truly do special things, I think that is the to me, what has constantly kept me motivated. Even at this level where I don't get to do a lot of the cool stuff anymore because I'm writing at desk most of the time, I'm traveling most of the time. But to be able to lead people who are doing that and to see them develop and mature is still a very, very satisfying part of my job.
We've been speaking with Rear Admiral Guido Valdes on this special episode of WarDocs podcast in collaboration with OP Med TV. Thank you, sir, for your time and sharing your insights. Appreciate your service. Thank you.
My pleasure. Thank you very much. Appreciate it, Ron. Thank you.
Thank you for tuning in to this special episode of WarDocs, made possible by a partnership with the Defense Strategies Institute's OP Med TV. To stay connected with Team WarDocs, visit our website at wardocspodcast.com. Follow us on social media for updates and subscribe to our WarDocs YouTube channel for more engaging content. Your support helps us continue to document the experiences and contributions of military medicine professionals as we honor the legacy and preserve the history of military medicine for the next generation.